Welcome back. Thanks for being with us here on Morning Live. And of course, our apologies, just sorting out that connection to Minister Zweli Mkhize. In the meantime, let's just give you a quick recap on our question of the day. And this, of course, in response to what the President announced last night. And we're asking you, what's your reaction to President Ramaphosa's address to the nation last night? Hits, misses, did you want more? Are you still questioned about certain things? Let us know your views at Morning Live SABC. I believe we do have Health Minister Dr Zweli Mkhize now on the line. Minister, thank you so much for speaking to us. Apologies, that connection letting us down with regard to bandwidth, not great, but we do have you on the line. Thanks for speaking to us.
Thank you very much. I hope this one holds. I think the signal is quite weak. I'm not sure where the challenges are.
Yes, this one's perfect. Thank you so much, Minister. So, Minister, let's start with, where we left off last week when we last spoke. And at that time, we were talking about when we can expect the first batch of vaccines to reach our shores. Are we any clearer this morning?
Yes, we are clearer. The dates that we had said that we're expecting the first batch around January, that still stands, and we believe that will be the beginning of the delivery of various batches. The first one is 1.5 that we said will come in January and February. And then we are pushing to get as many other companies to offer more of their vaccines early, because the real issue is not whether the companies have got the right vaccine or not. It's whether they've got it early. That's really the issue we're fighting and pushing for.
With regard to exact dates, Minister, are we not able to put any on the table right now?
It will not be easy to put up a specific date. However, we have a signed agreement that's committing the start to ship the vaccines to be here in January and in February.
So with regard to that rollout plan, and let's just start by talking about frontline workers. As you explained to us last week, the frontline workers, as in a medical field, will be taken care of first. And you said that would be everybody from doctors to cleaners. So in that regard, we spoke to the South African Medical Association chairperson yesterday, and she expressed concern about clarity with regard to exactly how that program will be rolled out, especially in the public sector. So have you worked out a program, in terms of how it's going to be done? And has this been shared with the officials on the ground?
Well, when we share the information, we share it as we are ready to discuss, even before we meet all the players. So there are going to be many of the stakeholders that we're going to be meeting in the next few days. For example, the unions, we have a meeting scheduled for Friday. Other civil society partners also will meet, some of them on Friday. We've already had a meeting with religious leaders. We've already had a meeting with traditional leaders. And so we are going to be meeting many players as we go along. I think that we must just all be patient. We'll get to a point where we'll have informed everybody and have got their buy-in. We already had several meetings with business. So because there are different issues to discuss with different groups, we're taking our time to go through that, but they will all be reached out to.
So teacher unions also expressing concern about them being prioritized before schools reopen. Can we talk about exactly how the government and the Command Council have worked on and looked at the prioritization of who receives the vaccine when?
Well, the prioritization was worked upon by the Ministerial Advisory Committee. Those are the team of experts who are saying we must target to reach everyone, but we won't reach everyone at the same time because the vaccine won't be available exactly at the same time, for all the people. So in order to be able to deal with, groups of people in phases, let's start with those who are treating the patients. We are saying that those are the first group we are going to target. Next are going to be those who are part of the frontline services, which are the teachers, the police, and the various people who have to participate in service to the public, who can easily be infected and therefore at risk of being exposed. And so that falls into that category. So it's a whole list of them. We teachers, I've seen that some of the teachers were saying that they should have been the first ones. I think you must expect everyone, I'm sure if you ask anyone out there, they'll also want to be the first ones. But I think the approach is a very fair approach that basically says we'll deal with the one batch and go to the next batch and to the next batch. It allows us space to be able to deal with the risk profiles. Yes, the teachers still have a high profile compared to maybe other people, but nevertheless, they are actually very close onto the starting of the vaccine. But we have to start with the health workers who are treating people where there's obviously a high concentration of the infection. And then, of course, the teachers, the police and others will all be coming soon after that.
Minister, not quite everyone looking forward to being vaccinated. And how do you foresee yourselves dealing with those who do not want to be vaccinated?
I think it's also another issue that we need to deal with here, that there are people who are very concerned about the vaccines. We think that there are a lot of stuff that's circulating in the social media, videos, and people who are saying these vaccines are bad and all of that. What we intend to do is to roll out enough information to reassure the public of the need for the vaccine and the safety of the vaccine and the fact that we all need it so that we can protect one another. And I think it's important for us to also indicate that a lot of safety issues have been dealt with through the trials, and in the process, we are going to be monitoring if there's any side effects that's associated with the vaccine. Now, some people have taken the views that are coming from different other countries where there are people who have been very skeptical about many issues involving the vaccine. But the truth of the matter is that we're using a lot of vaccination for many diseases. And if we hadn't, we would actually be having a huge burden of diseases. The issue of measles, for example. Everybody out in the villages knew what measles was, but it was a very mild thing in our case where it would just create a bit of rash in the body and a slight cough and so on. Whereas in the Congo, for example, in the past few years, there were huge mortality associated with measles. Now, the issues of polio, smallpox, and mumps, and tetanus, and so on, these are diseases that have caused huge, problems in the past that we have actually avoided simply because of the use of vaccines. And so it's important for people to know that when we talk about vaccines, it's not just a new thing that has never happened before. And the mechanisms of, prevention of diseases is actually, it starts with the access to immunization so that people can build immunity against infection long before they even come across that infection. So it's a very, very important discussion. So we have actually had discussions, for example, with the religious leaders, with traditional leaders, and they were saying that they want to work with us to actually roll out this program of community awareness. I am sure that by the time we have sent the information through, we would have been able to reassure many members of the public about the safety of the vaccine and the fact that we all need to take this vaccine. So we would then say that whilst we are aware of all of these issues, some of them are complete disinformation. The issue of 5G and COVID-19, there's no association whatsoever at that level. And we were, as I was explaining last week, we note that people are, bringing these issues up and they want to debate them, but sometimes the lack of information makes it difficult for people to be able to digest this information. So we need to go through that kind of discussion amongst ourselves.
Be that as it may, Minister, we are a constitutional democracy. People do have constitutional rights. Do people, and perhaps I should ask this more pointedly, do individuals have the right to decline vaccination?
Well, I think we start from a point of view of good faith, that if people have not got enough information, they would be worried about certain things. I can recall many years ago, when I was very young, I think I was about 7 years or so, when the whole program on vaccination came. My father was dead against it, and he actually said we mustn't be taken there. My mother was very worried, and she took us there to vaccination. So it was a very hot debate amongst them as to whether this was good or bad for the children and so on. So I think we start from a point of good faith to say those who are refusing, they'll refuse largely because they need more information, and that's where we would like to start. At the end of the day, we will not be able to force individuals to take the vaccine. However, people need to also understand that by so doing, they're actually risking their lives of being exposed to an infection that could have been prevented, and therefore they need to be made aware of that. So yes, it's a constitutional democracy. It basically means that there must be informed consent. People must know why the thing needs to be done and why it's good for them. And based on that, they must take a positive decision on the basis of the fact that they, as responsible citizens, they would like to participate in the creation of a goodwill of the whole community, and the creation of a healthy population. So I don't believe that we're dealing with a situation where, there has to be a big fight about it. I think that with more and more information, more people will be reassured. There may be some who might be having various concerns, for example, but those concerns actually, I don't think they are so huge that we should anticipate a large number of people who will not be vaccinated.
But bottom line, people will have the right to refuse or decline vaccination.
Well, let's put it this way, because I don't like us to send a message that says people must refuse. We're basically saying we'll explain it to them so that when they give consent for the vaccination, they've been fully informed about what it's all about.
And then, of course, Minister, the issue of prisoners and them being prioritized also for vaccination has also been raised by the broader public in questioning how that decision has been arrived at. If you could just walk us through that, please.
Well, the prioritization is really blind as to who we're dealing with. It's more about what the risks are that people are at that can easily spread the infection. And so they basically were classified as people who are in congregate settings where a large number of people are together and, of course, the risk of spreading the infection. Now, if you vaccinate everybody and live out the prisons, that is where all our source of challenges are going to come from. Whilst people are in prison, we still don't want to lose them as people. So we hope that they will get out being rehabilitated and better humans. So it's not like that's where we can send people to die, as it were. So I think the point is that there are these categories, but really what one is hoping for, if you were to ask me, I'm hoping for a situation where the different phases are so close to one another because the logistical machinery is in place and the supply of vaccine is adequate to be able to move to as many people as possible, so that there's no sense of anybody feeling that they are left out while the others are getting attention. I think it's because we are starting this program. That's why it's raising so many questions. But at the end of the day, we have to go by what is the guide, which is based on where the highest risk should be.
And then, Minister, the President also spoke about getting about 20 million doses of vaccine before the end of the year, and the whole question of herd or population immunity. So are there any timeframes, clear timeframes at this point as to how and when those vaccines will be expected and will be rolled out?
You will find that as the time goes on, you'll be getting different numbers of vaccines reported as being secured. And that is because this is work we're doing every day and night to reach out to these companies to actually try and secure. So whatever batch we are able to secure, we are then able to talk about it. You will also notice that President didn't come up with the names of the company. That is because a number of these are locked out in the non-disclosure agreements, which we are not ready to announce. But the one, for example, that we announced, we had to ask for a special authority or to clear us and allow us to talk about it in public. But you will find that the others are not ready for that. And so the numbers that we have secured as we're talking now is up to 20 million the President spoke about. But in fact, in the next week or so, the numbers will be much higher. And only once the issues are complete and are finalized and closed, and that we can now release the public statements, we'll then issue a complete indication of the supplies and delivery dates and everything. The various companies that we're dealing with, they have to actually start juggling their stock, moving some from this other and so on. Sometimes we agree that they'll give us so much, but to say, but you're starting too late, please change that, and then they'll say, okay, wait for us. Well, let's see and what can be done to shift the dates and change and try and meet your demand. Particularly in our case, we've actually made a strong case that South Africa is having a huge wave, and it's more severe than what we had what we had expected, and also that it came a bit early, much earlier than we had initially anticipated, and it's the largest hit in the continent. So we are pushing a bit earlier, and everyone is sympathetic about it. And on that basis, we are then saying that the challenge is to get them to confirm and secure that do earlier. It's not so much whether we could have ordered everything and signed it all off because, you can't get enough stock to last till the end of the year. We're not waiting for someone who's going to deliver at the end of December next year. So we're saying, no, we want earlier. That's why we have to hold it like this, because we're trying to push them to deliver much earlier. So the 20 million, for example, part of it consists of the COVAX facility that is confirmed, and with a media discussion a few days ago with the CEO of Gavi in charge of COVAX, and they were actually saying they're doing everything to try and help us to prioritize because of the pressure that they see South Africa is at, and in particular the concern that the sooner we can deal with South Africa, the sooner we reduce the risk into the rest of the continent, because South Africa is is almost a central metropolitan area where there's an exchange of passengers traveling into the continent. So that is an issue that we're really pushing at. So the COVAX facility is counted in there. There's a couple of other companies, manufacturing companies, that have actually agreed to supply, but because we have not agreed on the exact date and we're pushing for an earlier date rather than what they were saying is possible, we are not then releasing much of the detail. However, in the process, we are hoping to make sure that we can get as much as possible so that as many people can be covered, and then these phases will actually more or less overlap very close to one another, so no one waits until too late.
Now, Minister, the skeptics have said that these non-disclosure agreements are just hogwash, because what is it exactly that you would be signing non-disclosure agreements about? Which part of the information is not open to the public?
Well, they could say it's hogwash. There are people who have got the luxury to just criticize and not being involved in any of these issues. And so I would not spend much time to glorify those kinds of comments. All I can say is that if you order anything from someone who owns it, you have to agree with certain terms of their confidentiality about their product, about how they deliver. Let me also just say this. You see, there are many countries that have ordered stock and they've paid for it, and the stock has not been delivered because of the backlog in the payment, in the production. Now, at the same time, you also have us who are negotiating for earlier dates, and some of that is a reasonable case that allows people to say in their discretion they can actually, looking at the intensity of the situation in some of the countries, they can then consider changing certain things. If you're going to go and publish everything out there, you might actually start compromising the way that they want to sequence some of the supplies. It's not our space; it's their space. Then the details of what we, for example, you have seen that. Excuse me. You have seen that one manufacturer had actually a published price and said that the price was $15, and in the process, we negotiate instead of us knowing or getting all the information. Somebody decides it must be leaked that we have been given so much of this. We still are not happy with the price. We're trying to negotiate the price. Someone says, "Oh yeah, you've been given a discount. Why don't you?" We can't negotiate in public. You never do that. So I think that people must just calm down. Even if they undermine the work we do, they must understand that we will still have to do and deliver for the country what is needed. So we've seen lots of comments, and people do have the luxury to make all the comments which really don't have much to do with the reality that we are dealing with. And if somebody doesn't own the manufacturing company and does not own the production of the vaccines, they can't then tell us that it's not acceptable to have any kind of agreement to respect the terms that those who are manufacturing are actually wishing to keep confidential. In any business where you work, you actually have, in a confidential transaction, there are legal obligations which you have to apply to, which you are obliged to respect. And this is all that there is. Most of those in business know. You have a non-disclosure agreement. It's a legally binding issue. You can actually scupper the entire deal. So I think if we're going to be having, a pressure of people who are calling our processes hogwash, and yet we know that legally we are bound, we will respect the legal thing, and we'll actually just hope that people will understand that they were wrong in their criticism.
And as we wind this up, Minister, on average, how much are we looking at paying at this stage for the vaccine for a single dose?
The different companies, they've got different prices, and we are clear that we'll be buying from multiple vendors, multiple suppliers. So it is not possible to give you a figure. We can only give you a figure once it's been agreed and paid. So we will not be able to give that figure. It will run into billions, and the different companies that are going to be giving us, we're trying to push for a more of a discount. And so only when those figures are finalized, we can actually give you a final figure.
And just finally, with regard to medical aid schemes, and they will, of course, also be contributing to the fund to actually procure these vaccines. When it comes to the actual rollout, how is it going to work? Will it be a case whereby, because of their contribution, they will be afforded a certain portion of the vaccine? Just explain to us how it's going to work, Minister.
Well, at the moment, we have the understanding that the medical schemes are going to make their contributions, and so they'll put up the contributions for the vaccines. At the same time, we are going to start the process of rollout. So we are actually having at this point a discussion between the department and the medical schemes. For example, if you look at the health workers, the bulk of the health workers that you've got, about 65 to 70% of them are actually all covered under medical aid. Although the government wants to deal with the health workers as a priority, in fact, the medical aids can, in fact, fund a lot of those. But before all of that is finalized in terms of how much they will fund and so on, government is already procuring the amount of vaccines that are needed. So it's an administrative issue amongst us that's going to allow us to have an easy process of being able to take the people to go out for vaccines, because under medical aid, there are many doctors who are involved who are the general or the family practitioners that look after those particular patients. And of course, government will also make sure that those who are not covered are also covered, are also vaccinated in the same program, rollout program. So all of that is still being refined amongst ourselves.
Well, thank you so much, Minister Zweli Mkhize, just giving us greater clarity on some of the announcements by President Cyril Ramaphosa last night with regard to the country's fight against the coronavirus. Let's take a quick break and